Patients who take too much potassium in their diet between haemodialysis sessions can get high levels of potassium in the bloodstream, and this can actually be very dangerous indeed. It can cause the heart to beat irregularly and it can in some instances be fatal. So for haemodialysis patients it's very important to stick to the potassium element of their diet and not to break that.
So if potassium is a problem for you, try to avoid high potassium foods like bananas, crisps, chocolate, spinach, baked beans and drinks like coffee, fruit juice and blackcurrant cordial.
If you have a very high level of phosphate, it's bad for you in two important ways. It's bad for your bones and can lead to softening of bones and development of pain in the bones, which can be quite debilitating for patients. And high levels of phosphate are also very bad for the circulation and can lead to calcification or hardening of the arteries, which can cause strokes and heart attacks in later life.
High phosphate foods to avoid include dairy products, eggs and nuts. If you do overindulge, you'll soon know about it. I'm sure many of us have experienced the awful itches. Alongside our dialysis and diet, phosphate binders taken with food are essential in keeping phosphate levels under control. There are a range of these tablets your consultant can prescribe, so if you find one type difficult to take, you can usually switch to another that suits you better. These are some of the key numbers you can manage. Your consultant will also monitor other things like calcium and post-transplant creatinine, and where necessary will talk to you about adjusting your treatment to improve the levels there. Take a look at the National Kidney Federation website, which is a useful source of information on knowing your numbers.